はい、こんにちは。骨盤調整高ヨガトレーナーの村井由紀子です。今日はですね、ニューヨークの、本当にね、数少ない、骨盤底筋の専門家の先生がいらっしゃるので、ニーディ先生にお話を伺いたいと思います。Hi, Nidhi.
Hi, Yuki. How are you?
Good, good. How are you?
Good.
Yeah, today's theme is prolapse, right?
Prolapse, yeah.
Yeah.
So we're going to talk about pelvic organ prolapse. Yeah, tell me what questions you have.
Yeah. But first, what is a prolapse?
Okay, so let's go back to this model. You had this before, right? And for our viewers.
いや、今ね、骨盤臓器脱って何ですかって今聞いてます。はい。
Okay, so this is the pelvis. Bone on the right side, bone on the left side. This is bone in the front. This is the back, tailbone. And if we cut the top off, we see the organs. I showed you last time. This is the bladder. This is the uterus, bladder where you collect your pee, where the baby is, and then rectum where the poop is. So these organs sit inside the pelvis. And if we look down here, this is vagina, anus. And ideally, what we should just see an opening here. We should not see anything in those openings. We should just see 3 openings. With prolapse, sometimes these organs that are supposed to sit high up in the pelvis start to move down. They start to stoop down from their place. And instead of being all up here supported, sometimes they come out through the vaginal opening or anal opening.
Sometimes.
Sometimes.
Okay.
So we'll see a little bit tissue of the either the bladder or the rectum or sometimes uterus coming through this vaginal opening, and that's called pelvic organ prolapse. So prolapse basically means, coming down from its higher position where the organs are supposed to stay here, they're coming down. So any coming down is prolapse, but sometimes higher degrees, we start to see them coming outside of the vaginal opening. It can happen to the bladder coming out, or the rectum coming out, or the uterus coming out.
ここから from here.
Yes, from the vagina.
Is it all of a sudden? 突然
No, not all of the sudden. I mean, sometimes all of the sudden, but usually over weeks at least, you'll start to feel slowly. Only time it's sudden is after childbirth. Like if there's a big injury while having the baby, then you might suddenly start to feel a new sensation in the vagina.
Right after the giving birth, or
a few days, yeah. When you're bleeding and it starts to settle down. But that's usually, there's an injury. If there's a big tear in the vagina, then the organs which were high up are starting to come down and you might feel it.
Wow. But maybe the couple of years later, some people will have this kind of prolapse.
Yeah, so it can happen right after childbirth. It can happen a few months after. It can happen a few years later. A lot of times it doesn't happen after pregnancy, but happens after menopause.
After menopause.
After menopause is very common because after menopause, estrogen goes down, you get weaker, all the organs.
The muscle is weaker?
The pelvic floor muscle gets weaker, all your other muscles also get weaker, and generally the vagina and the vaginal tissue gets thinner with less estrogen. So the organs start to have much less support, and prolapse increases. If you had a small prolapse before, it might get worse after menopause. So if you didn't have any, it might start to happen after menopause.
How many percent of women will have this?
I'm not sure of the statistics exactly on this. It's common. It's fairly common to have low-grade prolapse, grade 1, grade 2. I see it in my practice quite often. I think it's pretty common in postmenopausal women as you get older, that there's more and more.
More and more?
Yes.
So what is what are the symptoms?
So usually after pregnancy, after childbirth, or during pregnancy, but usually after having the baby, women will say or feel like there's something in the vagina that wasn't
Something in the vagina. I'm here.
Yeah, like something is in there that wasn't there before. Some women will say, I feel like I have a tampon in, but I don't have a tampon in. Like this. Like there's something in that opening. Sometimes it's like heaviness. Sometimes it feels like fullness. Like the area is full. There's an extra tissue. And sometimes women will be cleaning themselves after having a bowel movement or urination, and they will touch like the tissue, right?
Okay.
So, or they're taking a shower and cleaning themselves, and they touch tissue around the vagina. That there's like a little bump, and that bump doesn't feel normal, so they'll know that there's some extra tissue. Basically, it's extra tissue. You may see it, you may feel it. Usually it's not painful per se. By itself, prolapse isn't very painful, but it can be very uncomfortable because every time you do an activity that is strenuous, that will push down on the prolapse, it will increase and it'll make you feel tension or fullness in the area.
So if we will have that symptoms, what can we do? So just go to see doctor or?
So definitely talk to your gynecologist. That's not a bad thing, or OBGYN. The preferred line of treatment, the first line of treatment usually is pelvic floor physical therapy, right? So like you can see, these are the organs, and if we take them out, there's just this big muscle inside. So these organs pretty much sit on top of this muscle. This muscle can, along with its fascia and ligaments, can support these organs better. So what you need to do is make this muscle stronger and start to help, keep the organs in place. If it's low grade, means the organs are moving down just a little bit, one grade or 2 grade, we can bring it back up often. That it goes away altogether. If it's very far down, like it's coming out a lot, then we can't always put it back in, but we can prevent it from going further. So that's still helpful. There are, if you talk to your OBGYN, there are small ring or like a pessary that they can put in that will hold the organ up, and then you can start working on the pelvic floor, make it stronger, and then symptoms can definitely be managed. So pelvic floor PT would be the first thing to do. You should also manage constipation, because if you're constipated and you're pushing to have a bowel movement, or when you push down to push the poop out, you also push the organs out. So you can't push just in the back. You push in the front, you push in the back, you push everywhere. So if you're constipated and you're constantly pushing, you are constantly pushing down on the prolapse. So managing constipation, taking stool softeners, learning how to poop properly is very important. You should not be constipated. And you should not be bearing down in general. So I've seen people who like hold their breath and bear down when they lift something or they push something. And I know in yoga there's a lot of talk about breathing properly. So you should absolutely be breathing properly and not holding breath and pushing down into the pelvic floor. So you want to manage the pressure instead of pushing down into these organs now. You want to manage the pressure and pull up as much as possible.
Okay. Wow. And so how can we prevent these symptoms? Is it just
strengthening of pelvic floor, managing constipation, breathing properly, managing weight, weight has been shown to increase prolapse. So if you're getting older and you're getting heavier and less mobile, then it's important to start to manage weight. Or you already have a low-grade prolapse and you're gaining a lot of weight, it's important to consider losing weight to manage the prolapse. Yes, there is some research to support that obesity will make the prolapse worse.
So, and you said manage breathing means when we inhale.
So managing breathing, basically a lot of breath hold.
We should not breath hold.
Yeah, you should not be doing a lot of holding breath in your workouts, in your day. So I see a lot of people who sit and they poop like this, right? Or they sit and they do they lie down and they do exercises and they lift heavy weights, right?
Holding the breath.
Yeah. So if your strategy to get strong and to get strength is only by closing your mouth and holding your breath, you are pushing down.
Right.
So find other strategies in life. One of those strategies, as we talked about in last video, is to exhale and do a contraction. So if you wanna feel stronger, do something heavy,
always
exhale and engage your abs. That's a better strategy than holding your breath and engaging your abs. So that's what I mean by managing breath. You know, you should. I mean, it's not like you can't hold your breath here and there, but all the time should not be the thing. Same thing with constipation. Here and there you're pushing, but not all the time. Weight, yes. Pelvic floor physical therapy. Pessary is one other thing. If you have a small prolapse and you're worried that it might get large, then pessary can at least prevent it for some time because it holds it up and you can get stronger in the meantime. So all of these things you can do to prevent. Another thing to prevent during pregnancy is to stay very active. Stay active, keep working on your pelvic floor. Staying active will also make sure that you don't gain too much weight, which will again increase the pressure on the pelvic floor. So, and the last risk factor is the vacuum. When they use vacuum for the delivery or forceps, forceps and vacuum are known to cause more prolapse. Because it's a lot of pressure.
Right.
Now, delivery is not always in our control. So sometimes you have to use vacuum, sometimes you have to use forceps, but try to stay active during the labor. Make sure that you're trying to do everything you can and talking to your doctor to make sure whenever possible vacuum and forceps are not used. And if they are used, then you go back to using strengthening your pelvic floor right away.
Okay. And about the exercise, is it the running or the Zumba, like dancing, jumping is get worse of a prolapse?
So not always. Not always. You know, if your pelvic floor is very weak, then prolapse is gravity dependent, right? Because the organs coming down, it's going to come with gravity. So whenever it's not just running or jumping, it's also just standing. You're standing, the gravity is going to pull.
Right.
So yes, initially, if you just found out your prolapse, then yes, running and coughing and jumping will make it more. But that doesn't mean that it's always going to be like that. Once you start to strengthen your pelvic floor, you learn how to breathe properly, you learn how to jump properly, then you can eventually go back to jumping and running, but with the supervision of a therapist to make sure that you're not making your symptoms worse.
Okay.
So initially you should stop, but it's not like it's forever, it's going to make it worse. It's just that for now you stop and then we'll teach you how to do right things and go back to running and jumping if you need to. Same thing with lifting. Sometimes
lifting.
Yeah, sometimes women are told you can never lift. That's not true. You can lift, but you first have to learn how to lift. You have to learn what to contract. You have to learn how to prevent that prolapse from getting worse. You have to get stronger, basically.
If you don't have, if we don't have any prolapse problems, but definitely we should exercise always with breathing.
Yeah, I mean, that's a good idea. And I think I have learned that from yoga. That there's always a good idea. It's not necessary to always exhale when you do a Kegel, but we start that way because it's easy. If you exhale forcefully, the pelvic floor contracts pretty much automatically. You don't have to think about it. So that's where we start. That okay, exhale and contract, exhale and contract. But as you get better, you can inhale and contract. You can do opposite things if you want to. But if you're constantly holding your breath the whole time, I think that's not a great strategy in long term. So working with the breath is important. It's very important because diaphragm and pelvic floor, they kind of work together. So when you start to think about your breathing, you really start to think about your pelvic floor indirectly because they work together.
Interesting. Okay. So do you have any exercise to prevent this
So I'm going to show you a few things. First thing we'll do is, if you are somebody who just had a baby or you're somebody who recently had a baby and you just found out that you have a prolapse and you're just feeling it. So this is one of the things you can do to basically just reduce the symptoms. So you can come lie down. And I'm going to use a wedge here, but 2 big pillows will do the same thing. You can lie down. And pick up your legs in the air, and I'm going to put this here. Now go ahead, scoot down thick foam pillows, not like fluffy pillows. Maybe big blankets would be better. We get your pelvis above your rib cage. So we're basically taking away all that gravity that was pulling the organs down. So if you're feeling a lot of prolapse, this position will bring the organs back in place, will reduce your prolapse symptoms. So if you're a new mom and you're feeling a lot, being in this position for 10 minutes can really help get that symptoms. And while you're here is a good time to do Kegels, right? So you can just stay here for 5 minutes and then breathe into your belly. And as you breathe out from your mouth, think about pulling a tampon in. Yep. And then breathe in. And you can do that for 5-10 minutes. Okay. Similar thing. So if you're feeling a lot of pressure in the vagina, this is a good position. If you're feeling a lot of pressure in the back, in the rectum where you poop from, yep, like that. But bend your knees.
Bend your knees.
You need this here.
Okay.
Put this here.
Put this here.
There you go. Okay. Yes. So this will be a good position to be in if you're feeling a lot of pressure in the back. Same exact idea. The gravity will pull the organ back, and then you can stay in this position and do some Kegels. Right? Okay. Then come up. So these 2 positions are great to decrease the symptoms. Once your symptoms are going down, it's important to start to learn activities, how to lift, how to carry. And your back is rounded, and your upper back is rounded, and you go to pick something up, then there's a lot of pressure because your abs aren't really functioning very well in this position, right? So if your back is rounded, your lower back is rounded, then your abs aren't working. So when you go to pick something up or even bend over, there's a lot more pressure to your pelvic floor. Versus when your back is straight and you keep your abs just gently engaged, breathe out, gently engage, and then you lean forward. In this position, you can automatically feel that your legs are working, your abs are working. And then when you go to pick something up, it's much more likely that your pelvic floor will not feel extra symptoms. So try the first one first. So if you bend your knees, a little bit, and just slouch. Yep, kind of like if you lean forward to pick something up, you'll feel more pressure in your vagina.
Yes.
Right?
Yeah, I can feel it.
And now, sit just like that, but straighten up, and then you're gonna just hinge forward.
Oh, here.
Don't
Here.
Yeah, don't arch your back. Good. Engage your abs. Hinge forward, and now bend over. You'll feel a lot of work in your legs, a lot of work here, and you won't feel it in your pelvic floor.
I can feel some space here.
Yes.
Yeah.
Because what happens is when your back is straight and your abs are working, abs and pelvic floor, they're friends. They work together. So if you are breathing out and your abs are working, your pelvic floor will work automatically. You don't have to think about it. So it's so protective. Using abs is so protective of pelvic floor that if you maintain good posture, you breathe right, and you engage your abs, so many times you'll just automatically engage pelvic floor and not have to think about it. So I'll teach my patients a lot how to pick up that baby, because you gotta pick up that baby.
Okay.
Right? You have to bend over and onto the crib. You have to go get to the floor, bathtub. So I'll teach my patients to keep their back straight, and after keeping their back straight, exhaling and engaging the abs. And as soon as you exhale and engage the abs, pelvic floor goes up by itself. And now you have a good support. So go pick up the baby.
And exhale.
And exhale.
Pick up the baby.
I had a vacuum delivery.
Oh, really?
Yeah. My baby is 8 months. I had a vacuum delivery. I was starting to feel pressure 2-3 weeks after giving birth, and I did the same things. Good posture, always exhaling, and now I'm 8 months postpartum. I don't feel any pressure anymore.
Oh, that's great. That's great.
So it's really protective if you start to do it early enough. Before you go to like 6-week postpartum, you can already start to connect with your breath, connect with your pelvic floor. You even think about pelvic floor. Just think about breath and abs. That'll get the pelvic floor to work.
So if we start this exercise from today, we are not gonna have that prolapse, maybe.
It depends on how strong you are, how much weight you have, how heavy is the baby. Like my baby was tiny when I started doing this. He was 6 pounds. Now he's, I don't know. So sooner you start, better it is.
Okay. Right. Wow. Thank you so much, Nidhi.
You're welcome.
Prolapse. ね、骨盤臓器脱、エクササイズでもう本当に、絶対とは言えないまでも、かなり、予防と、改善も十分にできる、ものなので、ぜひね、もし今、そういう感覚が、もしかしたら骨盤臓器脱かもっていうような、ちょっと違和感がね、股間のところにある方とか、もしいらっしゃっても、このエクササイズしていただければ、絶対ね、良くなりますので、諦めないで、ぜひエクササイズしてください。ただ、必ず専門医のね、先生に、フィジカルセラピーとか骨盤の専門のできれば先生に受診されるのはもちろんこれはもうまず初めに必ずやっていただいて、それと並行してエクササイズをしていただけたらと思います。はい、今日はありがとうございました。
Thank you.
Thank you.
Hi.